All right, so get this. You guys sent in a ton of stuff on Finland and their journey with heart health, and wow, it's incredible. We're going to really dive deep into how they went from like super high rates of heart disease to some of the lowest in the world, and it's not just about like eating salads all day.
Yeah, it's really interesting because they took this whole society approach. It wasn't just doctors and hospitals, but like culture really shifting that played a big part.
Okay, so the main article we're looking at is Finland's bold push to change the heart health of a nation. And let me tell you, some of this stuff is like straight out of movie. We're talking reality TV shows, competitions between villages, and even housewives like secretly rebelling against fatty foods. It's wild.
It does kind of sound like a public health campaign meets a spy thriller or something.
Right. Okay, so to get this, we got to go back to the 1970s in North Karelia. So picture this post-World War II. The region's struggling people are having a tough time, and men are dying young from heart disease, like way too young.
Yeah, the article called it the curses of the borderlands, which I thought was a really striking image.
Oh, yeah, totally sets the scene. And the numbers back it up, too. In 1969, 643 out of every 100,000 men aged 35 to 64 were dying every year from coronary heart disease. That's 2 to 3 times higher than other countries at the time, so not just a little problem here.
No, it was a full-blown crisis, and that's what led to the North Karelia project, led by this guy, Dr. Pekka Puska. And their goal was pretty radical. They wanted to change the entire lifestyle of the region to prevent heart disease.
Okay, so how do you even begin to do that, change an entire lifestyle?
Well, they went after the big 3 risk factors. Hypertension, cholesterol, and smoking. But they didn't just lecture people. They got creative with it. They used media campaigns, town hall meetings, even went door-to-door chatting with people in their kitchens.
Door-to-door about heart health. That's commitment.
Yeah, it was all out. They also gave farmers incentives to change what they were producing at these village competitions to see who could quit smoking the most. To get this.
Yes.
They had a reality TV show called Keys to Health.
Wait, a reality TV show back then? Was this like the original Biggest Loser or something?
It's kind of similar, but with a different focus. So picture this. Finns tracking their cholesterol and smoking habits on national television. It was actually one of the first examples of the reality TV genre, and it was hugely popular.
Wow, so they went from curses of the borderlands to reality TV stars fighting heart disease. That's a plot twist I did not see coming. But seriously, how did they get people to buy into these huge changes?
Well, here's where it gets interesting. The article points out that while men were running the government in these programs, women were the ones running the kitchens. And they were tired of losing their husbands so young, they became major allies in this fight.
So the housewives were the real revolutionaries here.
Absolutely. They were crucial in changing what families were eating, often in very subtle ways. For example, the push for low-fat diets. Well, that wasn't too popular with dairy farmers.
Yeah, I can imagine that would cause some tension. I mean, people's livelihoods were at stake.
Exactly. So some housewives started secretly mixing oil into their butter and diluting full-fat milk. They were determined to make things healthier, even if it meant bending the rules a little.
That is brilliant. Talk about fighting the good fight. But it sounds like changing people's habits was only one part of it. What about the larger system? Did the government play a role too?
Oh, definitely. The government actually found ways to support dairy farmers as they switched to making healthier products. So it wasn't about demonizing anyone, but finding solutions that worked for everyone.
So a more collaborative approach.
Very much so. And that leads us to another key player, the Marthas.
The Marthas, who are they?
Think of them like the original health influencers. They were this Finnish housewives organization with a long history of promoting health and homemaking, and they had this vast network. They were really effective at spreading the project's message, especially to men who might have been a little more resistant.
So kind of like trusted messengers within the community.
Exactly. They were sharing recipes, tips, encouragement, all through their existing social circles. And they weren't afraid to challenge those traditional ideas about food and health.
So it was like this combination of top-down policies and this bottom-up movement all happening at the same time.
Precisely. And the results? Well, they speak for themselves. By 2012, North Karelia saw an 82% reduction in deaths from coronary heart disease among middle-aged men, and Finland as a whole saw an 80% drop.
Those are some serious numbers. That's a real testament to what can happen when everybody gets on board.
It's tempting to give all the credit to the North Karelia project, but to be fair, improved healthcare, new medications like statins, and broader changes in society probably played a role too. It's complex.
Right. It's not a simple cause and effect, but even if it's hard to pinpoint the exact impact, the project definitely did something right. And it sounds like the housewives were a big part of that.
Absolutely. Their actions, even the seemingly small ones like mixing oil into butter, They really demonstrate the power of individual choices and the ripple effect they can have.
Okay, so we've got this picture of a community coming together from kitchens to TV screens to tackle heart disease. But what about the long term? Did this revolution just fade away, or did it fundamentally change something in Finland?
That's a great question. And it takes us to one of the biggest impacts of the project, the concept of risk factors. Before, this health was often seen as something outside your control. You got sick, you went to the doctor.
So they shifted the focus from reacting to illness to preventing it.
Exactly. The North Karelia Project brought in this idea that we have agency over our own health, that the choices we make directly impact our risk of getting sick. It wasn't just fate anymore.
It's like they empowered people to take control of their own well-being. Did this idea of risk factors catch on outside of North Karelia?
It became a national conversation. The article mentions how Finland actually implemented food labeling laws to help people make healthier choices. They wanted to make it easier for everyone, not just those in the project, to understand what they were eating and how it could affect their health.
So they went beyond just education and actually changed the environment to make healthy choices easier.
That's a key point.
Yeah.
They understood that while individual choices matter, they're heavily influenced by the options we have available.
That makes a lot of sense. Okay, so we've covered a lot of ground here. We've seen the struggles of North Karelia, the creative strategies of the project, and the surprising role of housewives in this whole revolution. But what about now? What does modern-day Finland look like after all of this?
That's exactly what we'll explore in part 2. We'll see how this heart health revolution is still shaping Finland today, and what lessons we can all take away from their experience.
It's amazing to think about how much of this whole journey was about changing mindsets. You know, not just habits.
Absolutely. And the article actually talks about how they use storytelling and personal connection to really reach people. It wasn't just about, throwing facts at them.
Right, like that anecdote about Dr. Puska, the head honcho of the project, being recognized by a bus driver years later.
Oh, yeah. The bus driver who quit smoking on the spot.
Yeah.
It just goes to show how powerful these messages were. They became a part of the culture. People saw real lives changing and felt inspired.
It makes it so much more tangible, right? It wasn't some abstract idea of risk factors. It was real people seeing real benefits in their lives.
And speaking of real people, let's talk about the historical context for a minute.
Yeah.
I mean, the article paints a pretty stark picture of life in North Karelia after World War II. It wasn't just about food choices. It was about coping mechanisms and survival.
Yeah, it is kind of heartbreaking. You know, these men, they fought for their country, came home to a devastated economy, a sense of loss, and they turned to what was familiar, smoking heavy meats, tons of dairy, almost like self-medicating with what they had.
The article says they took the land they were given, cleared the forests, and used it to raise cows and pigs. Their diet went from, fish, game, rye, bread, root vegetables to all this salt pork and cream, a huge shift.
And it really shows in those numbers. We talked about how the death rate from heart disease was 2 to 3 times higher in Finland compared to other European countries and Japan.
And the highest rates of all were in North Karelia, where the war had hit the hardest. It's a good reminder that health isn't just about individual choices. It's about history, economics, all these bigger forces.
It really makes you wonder how much of what we choose is shaped by things we don't even realize.
That's what the North Karelia Project understood so well. They didn't just address medical needs, but the social and economic landscape too.
And one of their more unusual tools was reality TV. I'm still fascinated by this Keys to Health show.
It's such a unique approach, especially for that time period. If we had a heart health reality show today, it would probably be all extreme makeovers and crazy workout routines.
Oh yeah, lots of drama. Probably some questionable diet advice thrown in there too.
Right, but Keys to Health was different. It was like the article describes it, a Finnish Biggest Loser. But the emphasis was on education and community support, not competition. It actually encouraged viewers to track their own habits alongside the participants.
So more about empowering people than entertaining them.
Exactly. And it was a massive hit. It got people talking about heart health in a way they never had before.
So we've got these cultural shifts happening, but then there's the economic side too. Remember the fat wars, all that pushback against reducing fat in people's diets?
Oh yeah, that was a major clash with the dairy industry. I mean, it was a direct threat to their livelihood, and understandably so.
It's a good point that even well-intentioned public health efforts can have unintended consequences. It's a tough balance to strike.
For sure. But eventually, the Finnish government stepped in to help dairy farmers transition to healthier products like low-fat milk and alternatives that were higher in protein. It just shows that solutions often require everyone to compromise a little.
And this brings us back to those incredible housewives. It wasn't just top-down change, it was people working within the system to make things better, like secretly adding oil to butter. That's genius.
It really speaks to their ingenuity.
Yeah.
You know, they were facing resistance from their families, from tradition, from the economic realities of the time, but they found a way to make it work.
They knew what needed to be done and nothing was going to stop them, and they had the Marthas helping to spread those ideas, too. It wasn't just individual action, it was a whole network.
It highlights the power of community recipes, tips, offering encouragement. It created this ripple effect that touched countless lives.
I'm seeing a pattern here. The North Karelia Project wasn't just one thing. It was science. It was policy. It was people on the ground making choices every day. It was a cultural shift, but a very practical one.
And that's a key takeaway. I think it wasn't about forcing people to change, but empowering them with knowledge and support.
Yeah.
It wasn't about guilt or shame. It was about finding a better path forward together.
So what does this all mean for us today? I mean, this happened decades ago in a very specific context. Is it even relevant to our lives now?
That's the big question, isn't it? And that's exactly what we'll be exploring in part 3. We'll look at how Finland's experience can inform our own approach to health, even if our challenges and circumstances are different.
So we've seen how Finland tackled this heart health crisis head on. You know, they changed diets, they even changed laws, but this all happened a while ago. What's the takeaway for us today?
That's the big question, right? Does this amazing story have any relevance for us now?
Right. Like, Finland's cool and all, but they're not exactly facing the same stuff as, like, someone living in a busy city today, right?
Yeah.
Different food, different stresses.
You're right. The context has definitely changed. But the principles behind Finland's success, I think those are surprisingly timeless.
Okay, unpack that for me. What are those principles and how do they apply to our lives today?
Well, one key thing is this idea of individual agency combined with societal support. Remember how the project empowered people with knowledge about risk factors, but then they also changed the environment to make healthy choices easier.
Oh, yeah, like those food labeling laws, making the information clear and accessible so people can make informed decisions.
Exactly. And think about how that applies today. I mean, we have access to more information about health than ever before, but it can be so overwhelming and confusing. What if we focused on making that information easier to digest and actually use?
So not just throwing data at people, but making it relevant to their lives.
Exactly. Imagine grocery stores that are designed to highlight healthy options, or apps that translate complex nutrition science into like simple actionable tips.
That would be amazing. It would take so much of the guesswork out of healthy living. But individual choices are only part of it, right? What about those big systemic changes? Can we really expect to replicate what Finland did on a larger scale?
It's definitely more complex today, but there are still things we can learn from their approach. Remember how Finland incentivized farmers to shift towards healthier products?
Yeah, they actually supported the economic transition instead of just, demonizing certain industries.
Exactly. That's a crucial lesson today. We see so many debates around food policy, and it's often framed as like this us versus them thing. But what if we focused on finding solutions that benefit everyone, from the people who produce the food to the people who eat it?
So more collaboration, less finger-pointing.
Exactly. Imagine policies that help farmers adopt more sustainable practices or tax breaks for companies that make healthier foods.
I love those examples. It's about creating a system where healthy choices are the easy choices for everyone involved, but it's not all about policies and systems, right? There's also that element of community and social support that was so huge in Finland. Can we recreate that in our, increasingly digital world?
That's a tough one, for sure. But the core idea is still relevant. People are more likely to make lasting changes when they feel supported and connected.
It's like those housewives sharing recipes and tips and just encouraging each other along the way.
Exactly. We need to find new ways to foster those connections today. Maybe it's community gardens that promote healthy eating, or online platforms where people can share healthy recipes and support each other's goals.
That's such a cool idea. It's about tapping into that human need for connection and belonging, but channeling it towards something positive.
And let's not forget the power of storytelling. Finland used reality TV to make heart health relatable and engaging. We can do the same today using different mediums.
Right? Like, imagine a heart-healthy cooking show that's actually fun to watch, or a documentary that tells the stories of real people who've transformed their lives through healthy habits.
It's about going beyond the numbers and the dry facts and connecting with people on an emotional level.
I'm really starting to see how all these pieces fit together. It's not about copying Finland exactly, but adapting those core principles to our own unique challenges and opportunities.
Exactly. Their experience shows us that lasting change takes a multifaceted approach. You need individual action, supportive policies, strong communities, and compelling stories.
It's like weaving a tapestry. Each thread represents a different part of the solution. It's complex, but it's also really hopeful. It shows that we're not powerless against these health challenges.
We have the tools to create a healthier future. It just takes all of us working together.
And maybe a little bit of that rebellious housewife spirit.
Absolutely.
Yeah.
So to bring it all back to our listener, what's the one big takeaway you want them to walk away with from this whole deep dive?
I think the most important message is this Finland story shows us that huge transformative change is possible. It won't be easy and it won't happen overnight, but by embracing those principles of empowerment, collaboration, and community, we can create a world where everyone has the opportunity to live a long, healthy, and fulfilling life.
That's a great way to put it.
Thanks for joining me on this deep dive. It's been a pleasure.
It's been fun.
And to all of you listening, we hope this deep dive has given you some food for thought and maybe even inspired you to take action after all. As Finland's story shows, even small changes can have a huge impact. Until next time, stay curious, stay engaged, and keep diving deep.